A mental health crisis is a situation of intense emotional or psychological distress that requires immediate attention and intervention. It can manifest itself in many ways, including strong feelings of sadness, anxiety or fear, losing touch with reality. Mental health crises can be caused by genetics, environmental stressors, traumatic experiences, and a number of factors. They can occur at any age and affect people from all walks of life. A person experiencing a mental health crisis may exhibit a range of signs and symptoms that can vary depending on the individual and the nature of the crisis. Some common signs and symptoms of a mental health crisis include extreme mood swings. A person may have sudden and extreme changes in mood, such as from extreme happiness to deep sadness. Agitation or restlessness. A person may seem agitated or restless, pace back and forth, or be unable to sit still. Difficulty concentrating. A person may have difficulty concentrating or completing tasks and may seem distracted or distracted. Changes in sleep or appetite. A person may experience significant changes in sleep patterns or appetite, such as sleeping too much or too little, eating too much or too much. Disorganized thinking. A person may have difficulty communicating coherently or expressing thoughts and may appear confused or unfocused. It is important to note that not all people experiencing a mental health crisis will show the same signs and symptoms. In addition, some people may hide their symptoms or be unaware that they are having a crisis. If you are concerned that someone you know is experiencing a mental health crisis, you should approach the situation with caution. If you suspect that someone you know is experiencing a mental health crisis, there are several ways you can help. Here are some tips on how to help someone in a mental health crisis. Be there for them. One of the most important things you can do for someone in a mental health crisis is to be there for them and offer your support. Listen to them non-judgmentally, validate their feelings and reassure them that they are not alone. Encourage them to seek professional help. Encourage the person to seek professional help, such as calling a crisis hotline or seeing a mental health professional. Offer to help them find resources and provide support as they navigate the process. Stay calm and patient. It can be difficult to see someone you care about in distress, but it's important to stay calm and patient. Avoid getting angry, frustrated, or dismissive of their concerns, as this can escalate the situation. Help them create a safety plan. Work with the person to create a safety plan that outlines what to do in a crisis. This plan should include emergency contact information, coping strategies, and a list of resources. We can now also implement some common mental health crisis intervention techniques. Active listening. Active listening involves listening without judgment and with full attention. It involves reflecting on what they say and acknowledging their feelings and emotions. Stress reduction techniques. Stress reduction techniques aim to calm the person and reduce his anxiety. These techniques may include deep breathing exercises, mindfulness, guided imagery, and relaxation techniques. Safety planning. Safety planning involves developing a plan with an individual to ensure their safety during a crisis. This plan may include identifying triggers, developing coping strategies, and identifying emergency contacts and resources. Referrals to professional services. Crisis intervention may include referral of the individual to mental health professionals for ongoing support and treatment. In general, mental health crisis intervention aims to provide immediate support, stabilization and safety for the individual. It is an important component of mental health that can help individuals recover and regain their ability to cope with daily life. Remember that helping someone in a mental health crisis can be difficult, but your support can make a significant difference in their recovery. Encourage them to seek professional help and to be calm and patient.